overutilization of spine surgery in Idaho, and really in the country and the world for that matter. But why did we entitle this video Overutilization of Spine Surgery in Idaho? There's been several studies over the last couple of decades that have shown that Idaho is one of the highest surgeries per capita in the whole United States. Now, it doesn't take the cake for that above and beyond with every type of spine surgery, but this was several years ago in eastern Idaho with lower back fusion surgeries. Now, with all of that said, why are surgeries being done? And comparatively, how does chiropractic and how does a natural type of approach match up compared to the surgical approach? First off, something you have to think about is what happens when they do a spine surgery? Well, I have a spinal model here so I can show some of the things that are done in the most common surgical techniques. Let's just look at cervical spine, the neck. Okay, remember you have a bone, you have a disc, bone, nerve comes out in between. So if we look at like a side view model, okay, like so. So bone, disc, bone, nerve in between. Same configuration in the neck as it is the low back. This is technically a model of the low back, so the vertebrae are shaped a little differently, but it's the same idea, is that you have bones and discs and nerves. Now, what's the purpose of the disc? You've learned this by now, watching all the other previous videos in the 12-week transformation, is that the disc is a spacer and it allows movement between the vertebra. It is not supposed to be a shock absorber because of the fact that people lose curves in their spine or they have subluxations where the bone misaligns. That causes the joint to not move properly. The disc starts to have problems. It wears out prematurely. It swells up initially. And if it herniates or protrudes or swells, which only happens after it is subluxated, of course, then what can happen is those symptoms can be really scary. Scary meaning the arm can go numb, it can light up, even muscles can start to atrophy, all kinds of signs of nerve root compression. And if you go in and you get an MRI, so a special image of the neck, they'll show that the disc is herniated. That is how they then make their justification for doing surgery in a lot of cases. But technically, if you look at the guidelines of how they're supposed to justify surgery, it's not supposed to be just on an MRI finding, it's supposed to be on actual clinical exam. So things like a decrease in reflexes, meaning you take a little reflex hammer and you hit someone on the elbow and a couple different parts of the arm, and if things aren't firing, that can show that there's some significant nerve compression. And if it's left like that, likely it's going to damage those nerves even further and further. Also, you can check for sensation on the surface of the skin called a dermatome. Use a little thing called a pinwheel, and you trace that on certain patches of skin. You compare it from side to side, and you're looking for, is it hypersensitive or is it hyposensitive, like where you can't feel it? Those are signs and symptoms that the nerve function is starting to decrease. However, those are things that we look at as well when we do our exams and re-exams with our patients. And the cool thing is when we start adjusting the spine, when we start fixing the posture and fixing movement, all of those things improve as well. So now, when do you make the call to do surgery? Surgery has to be a last resort. There is a time and a place for it, and some of the best surgeons say no a lot more than they say yes. I have had the privilege of being able to observe a neurosurgeon here in town. He let me in the operating room. He was doing an anterior fusion surgery of a patient. It was a very surreal thing to see. They cut this guy about right here, opened up the front of the neck, and then they access the vertebra. They cut the disc out. They put this little square spacer in there. They shove some bone in there, and they put 2 screws into there, 2 screws below, and a plate in the front to fuse it into place. Now, as I was watching that, I was thinking, I would never want that to happen to me. However, if I had to have that, I would want to go to an extremely skilled surgeon like this guy who I observed. But how many of those cases are done when they're not really needed, for one, or what things do we see now on exam and on x-ray that is going to lead to a process of degeneration and problem a year from now, 5 years or 10 years from now, that by fixing things conservatively now you can prevent even being close to being considered a surgical candidate in the future. Those are the things to really understand here, is prevention is key, but when it comes down to crisis, is surgery the best bet? So with that foundation and intro to this video, what I'm not trying to say is that every single person on the planet can be fixed by conservative means. There is a time where if someone goes through all the conservative options first and it doesn't work, then surgery can be a last resort after injections and painkillers and things like that. But surgery needs to be a last resort. There's a saying that if all you have is a hammer, everything looks like a nail. And that can be true of any profession. Someone can critique us to say, oh, because you guys do conservative care, every patient that comes in, you think you're going to fix with conservative care. Not necessarily. We do a thorough exam. If it falls within conservative guidelines, then we make a call to see if we think we're going to be successful with this case. We are not into wasting a patient's time or our time, but more times than not, we're able to pull someone out of this and prevent them from having to go under the knife. So then the next question is, how does chiropractic do in the peer-reviewed literature as far as being effective at treating all these different conditions compared to their surgical counterparts? Let's take a look. Right here it says Medline, which is an online search engine for peer-reviewed publications. It says Medline contains over 24 million articles with almost 1 million new citations added each year. So let's just go down and look at this one on number 1. A systematic review of 24 studies strongly supports the existence of soft tissue connection between upper cervical muscles, and then it names those muscles, and the spinal cord dura, which is the outer wrapping that encases the spinal cord, the delicate spinal cord. This connection has pathophysiological and therapeutic implications that may help explain the beneficial effect of manual therapy on cervical cranial disorders, headache, and cervicogenic vertigo. So what this is implying is that different techniques in chiropractic to restore proper motion and function of a cervical joint or help to a cervical curve actually can be helpful, not just because it takes pressure off of a nerve root, so like the nerve in between, but a layer, a sheath that surrounds the spinal cord that wraps all the way up into the skull, all the way down into the tailbone, called the dura. It's that you can unravel or take pressure or tension off the dura, and that could be another feasible method of why chiropractic and spinal corrective care and movement correction is so beneficial for these types of conditions. Okay, number 2, this is comparing mobilization or manipulation or adjusting to all these other things: electropuncture, strain, counterstrain, relaxation massage, some passive physical modalities. So these other modalities by themselves, it says, are not effective versus adjusting the spine is effective. And this was back in December 2016. And then here in older adults with chronic neck pain, having spinal adjusting decreases societal cost 5% and results in greater improvements in pain and disability. So this is showing that all ages, all walks of life should be under chiropractic care. And furthermore, adding the spinal manipulation or adjusting to a home exercise program resulted in 47% lower costs compared to the supervised rehabilitation. So it means as we progress in age, as our parents and grandparents, or maybe some of you watching yourself, then as you progress in age, making sure that you're getting the joints of the spine adjusted yields way better outcomes versus just doing exercise and other types of rehab alone. So there's a handful of studies here. I'm not going to read through all of them right now, but I am going to put them on the page so that if you guys ever want to look them up, you can. So all those will be below. But it goes all the way through up to 14 of some of the most compelling recent studies talking about chiropractic and different types of rehab that we as chiropractors perform. So in summary, the overutilization of spine surgery in Idaho or in the United States, or the world for that matter, the moral of the story is that there are lots of helpful alternatives. Chiropractic adjusting, it should be at the foundation of that. Do not underestimate the power and the effectiveness of an adjustment, getting movement, getting irritation off of a nerve, helping heal a disc, decreasing pain, and improving health outcomes.